Blocked coronary arteries, atherosclerosis. Let's start with the big one, the classic villain in almost every heart attack story. Your coronary arteries are like highways that deliver oxygen-rich blood to your heart muscle. Now imagine someone's been dumping garbage on that highway for years. That garbage is plaque, a nasty mixture of cholesterol, fat, calcium, and other substances that builds up on your artery walls. This process is called atherosclerosis, and it's as bad as it sounds. Here's what happens. Over time, this plaque buildup narrows your arteries like a clogged drain. Your heart is basically screaming, "I need more blood," but the highway is down to one lane. Eventually, a piece of that plaque can rupture, kind of like a pimple popping, but way more dangerous and significantly less satisfying. When it ruptures, your body goes into panic mode and forms a blood clot to patch it up. Plot twist. That clot can completely block the artery. No blood flow means no oxygen, and your heart muscle starts dying within minutes. It's like cutting off the power to a city. Things shut down fast. The scary part? This buildup can happen over decades without you feeling a thing. You could be walking around thinking you're fine while your arteries are turning into a construction zone. High cholesterol, high blood pressure, smoking, and diabetes all speed up this process. Basically, atherosclerosis is the slow-motion disaster that causes most heart attacks, and it's been plotting against you since probably your 20s. Blood clots. Blood clots are your body's emergency repair crew. Normally, they're heroes. Cut yourself, clot to the rescue. But sometimes they're overzealous heroes who cause more problems than they solve, like a firefighter who accidentally floods your house. When a clot forms inside your coronary arteries, it can block blood flow to your heart, and boom, heart attack time. These clots often form on top of that plaque we just talked about, but they can also happen because your blood is just too clotty. Yeah, that's the technical term I just made up, but you get it. Some people have clotting disorders that make their blood thicker and more likely to form clots spontaneously. It's like having blood with the consistency of a smoothie instead of water, not ideal for flowing through narrow tubes. Certain medications, long periods of sitting like on airplane flights, dehydration, and even some genetic conditions can increase your clotting risk. Women on birth control or hormone replacement therapy have slightly higher risk too, because hormones can affect blood thickness. Also, if you've got atrial fibrillation where your heart beats irregularly, blood can pool in your heart chambers and form clots that then travel to your coronary arteries like tiny torpedoes. The ironic thing is, we have blood thinners to prevent this, but taking them means you might bleed more easily if you get cut. It's a delicate balance. You want your blood thick enough to clot when needed, but thin enough to flow smoothly. Too much of either, and your heart might have opinions about it. High blood pressure, hypertension. High blood pressure is the silent troublemaker of heart attacks. It doesn't cause them directly and immediately, but boy does it set the stage perfectly. Think of your arteries like garden hoses. Now imagine cranking up the water pressure to maximum and leaving it that way for years. Eventually, that hose is going to show some wear and tear, right? That's what high blood pressure does to your arteries. When your blood is constantly pushing too hard against your artery walls, it damages the delicate inner lining. This damage makes it super easy for cholesterol and plaque to stick there, like scratches on a surface collecting dirt. Your arteries also become stiffer and less flexible over time, like how a rubber band gets brittle if you stretch it constantly. This stiffness makes your heart work even harder to pump blood through, which is exhausting for an organ that's supposed to beat about 100,000 times a day. The really sneaky thing about high blood pressure is that most people don't feel it. You can walk around with dangerously high blood pressure feeling absolutely fine, which is why they call it the silent killer. Dramatic but accurate. Over time, that constant high pressure creates weak spots in your arteries and accelerates plaque buildup. It also makes your heart muscle thicken because it's working overtime, and a thick heart muscle needs more oxygen but gets less because, plot twist, the coronary arteries are getting damaged by the same high pressure. It's a vicious cycle. The good news? Blood pressure is controllable with medication, diet, exercise, and stress management. The bad news? You have to actually do those things consistently. Smoking. If there was an award for most reliable way to destroy your heart, smoking would win every single year. Seriously, tobacco is like a multi-tool of heart attack causes. It does everything wrong simultaneously, which is almost impressive in a terrible way. Let's count the ways smoking sets you up for a heart attack, shall we? First, smoking damages the lining of your arteries, creating those perfect sticky spots for plaque to build up. Second, it makes your blood more likely to clot because nicotine and other chemicals make your platelets stickier. They're basically holding hands when they should be keeping their distance. Third, smoking raises your blood pressure and heart rate, making your heart work harder while simultaneously giving it less oxygen to work with because, fourth, carbon monoxide from cigarette smoke replaces oxygen in your blood. Your heart is basically running a marathon while breathing through a straw. But wait, there's more. Smoking lowers your good cholesterol, HDL, and raises your bad cholesterol, LDL, and it can trigger those artery spasms we talked about earlier. It also makes you more resistant to insulin, increasing diabetes risk, which is another heart attack risk factor. It's like smoking looked at all the possible ways to cause a heart attack and said, yes, I'll take all of them. The absolutely wild part is how quickly your risk drops when you quit. Within 24 hours, your heart attack risk starts decreasing. After 1 year, your risk is cut in half. After 15 years, it's nearly the same as someone who never smoked. Your body is incredibly forgiving if you give it a chance. Diabetes and high blood sugar. Diabetes is like that friend who doesn't directly start drama, but somehow makes every situation worse. High blood sugar over time is absolutely brutal to your blood vessels and heart, and people with diabetes are 2 to 4 times more likely to have heart attacks than people without it. Let's talk about why sugar isn't so sweet for your heart. When you have too much glucose floating around in your bloodstream constantly, it damages the walls of your blood vessels. Think of sugar as sandpaper, slowly scraping away at your arteries. This damage makes it easier for plaque to accumulate and harder for your blood vessels to function properly. High blood sugar also causes inflammation throughout your body, and inflammation is like gasoline on the fire of heart disease. But it gets worse. Diabetes often comes with friends. High blood pressure? Check. High cholesterol? Usually. Obesity? Often. It's like the worst buddy system ever, where having one problem dramatically increases your chances of having all the others. This cluster of issues is sometimes called metabolic syndrome, and it's basically a heart attack starter pack. Diabetes also damages nerves, including the ones that let you feel chest pain. This means some people with diabetes can have silent heart attacks, where they don't feel the typical warning signs. Their heart is literally screaming for help, but the message isn't getting through. Type 2 diabetes, which is becoming increasingly common due to lifestyle factors, is largely preventable and manageable with diet, exercise, and medication. Your pancreas and your heart will thank you for keeping blood sugar in check. Trust me, they're comparing notes about you. Stress. Yes, stress can literally break your heart. And no, that's not just a poetic expression. Extreme emotional or physical stress can trigger a heart attack, and there's even something called broken heart syndrome or stress-induced cardiomyopathy that mimics a heart attack. Your heart and your brain are in constant communication, and sometimes that conversation goes very wrong. When you're stressed, your body releases hormones like adrenaline and cortisol, the fight or flight chemicals. These hormones make your heart beat faster, raise your blood pressure, and make your blood more likely to clot. Occasionally, that's fine, totally normal. Constantly, that's like revving your car engine in park all day every day. Something's going to break. Chronic stress also leads to inflammation, which, as we've established, is terrible for your arteries. Sudden intense stress can trigger a heart attack in people who already have underlying heart disease. There are documented cases of heart attacks during earthquakes, terrorist attacks, even during intense sporting events. Researchers found an increase in heart attacks among Germans when their soccer team lost in the World Cup. Imagine explaining to the emergency room that your team's penalty kick miss literally hurt your heart. But here's the thing about stress. It's not just the big dramatic events. Chronic everyday stress from work, relationships, finances, or just living in our chaotic modern world adds up. It affects your sleep, makes you more likely to engage in unhealthy behaviors like smoking or overeating, and keeps your body in a constant state of low-level emergency. Managing stress through exercise, meditation, therapy, or whatever works for you isn't just about feeling better mentally. It's literally protecting your heart from self-destructing. Coronary artery spasm. Okay, this one's weird and frankly kind of rude. Imagine your artery just randomly deciding to squeeze itself shut like it's throwing a tantrum. That's a coronary artery spasm. And yes, it can cause a heart attack even if you don't have any plaque buildup. Your arteries are surrounded by smooth muscle, and sometimes that muscle contracts intensely and suddenly. It's like a Charlie horse, but in your heart artery, and way more dangerous than the leg cramp that wakes you up at 3 a.m. These spasms can happen to anyone, but they're more common in people who smoke, use cocaine or other stimulant drugs, or have high stress levels. Cold weather can trigger them too, which is why you hear about people having heart attacks while shoveling snow. Sometimes they happen for absolutely no reason, usually early in the morning because apparently your body hates you most right after you wake up. The really frustrating part is that these spasms are temporary. The artery squeezes shut, cuts off blood flow, causes heart damage, then relaxes and acts like nothing happened. If doctors check your arteries later, they might look perfectly fine, which can make diagnosis tricky. Some people have variant angina, also called Prinzmetal's angina, where these spasms happen regularly, usually at rest or during sleep. It's your heart's way of keeping life interesting, except nobody asked for this kind of excitement. Treatment usually involves medications that relax blood vessels, and definitely avoiding triggers like cigarettes and cocaine, which should be obvious but apparently needs to be stated. Cocaine and stimulant drug use. Let's end with something that might surprise you. Cocaine and other stimulants are heart attack machines, and they don't discriminate based on age. Young, otherwise healthy people can have massive heart attacks from cocaine use, which is terrifying because these are often people with no underlying heart disease. Cocaine is basically a heart attack speed run. Here's what cocaine does to your heart, and it's a greatest hits of everything we've discussed. First, it causes massive spikes in blood pressure and heart rate. Your heart is suddenly beating way faster and way harder. Second, it causes your coronary arteries to spasm and constrict, cutting off blood flow. Third, it makes your blood clot more easily. And fourth, it increases oxygen demand while decreasing oxygen supply. Your heart is being asked to run a sprint while someone's choking it. The math doesn't work out well. The really dangerous part is that cocaine's effects on the heart can last for hours or even days after use. You might feel fine and think the high has worn off, but your cardiovascular system is still in chaos. Cocaine can also cause aortic dissection, where the main artery from your heart literally tears, which is catastrophic. Other stimulants like methamphetamine, synthetic cathinones, bath salts, and even excessive energy drinks combined with alcohol can cause similar problems. Young people especially don't expect to have heart attacks, so they might ignore warning signs or not seek help quickly. There's also fear of legal consequences that might delay someone from calling for help. But here's the truth. Emergency medical personnel care about saving your life, not getting you in trouble. If you or someone you know uses stimulants and experiences chest pain, shortness of breath, or other cardiac symptoms, get help immediately. Your heart doesn't care about being embarrassed. It just wants to keep beating.